Hello, this is Dr. Wells with Wells Medicine. A lot of patients coming to see us are worried about their IVs. IVs come in many different sizes, and most people will have the most experience with IVs that they've had either giving blood or in donating blood, or when they've gone into an emergency room or a hospital for surgery getting an IV. Those are all much, much larger IVs than the IVs that we need at Wells Medicine. So our gauge IVs, which is a measure of the size, are the very smallest IVs that they make commercially available. So they often use these in neonates in the hospital, and these are just very, very tiny IV catheters. A lot of patients are surprised at how little it hurts because they're so used to the much larger IV access that they've had in the other situations that they're more familiar with. Even when patients go to IV drip spas, they're using a much larger IV catheter than we use because we just have a tiny amount of fluid that we're giving over 40 minutes. So we don't need a giant access to the patient. When we take them out, because we hold pressure for about a minute afterwards, a lot of patients are worried about, am I going to have a very large bruise? Are people going to be able to see? Am I going to look beaten up? Or like I've got track marks, like I'm using IV drugs. We try to use the same hole every time if possible. And we hold pressure on it so that you don't develop a giant bruise, even if you're on blood thinners. We are very capable at performing IVs. So if you want one on the inside of your elbow, if you'd rather have one on your hand, we're pretty flexible about where we put it. Some people are very sensitive to whether it's on the right or the left, or whether it's on their elbow or their hand, or in a different spot entirely. And we're happy to be flexible and accommodate patients as best we can.